Welcome to Action Hound Media, the site and channel all about action. Life's boring. Get some more action into your life. This week I'm talking about vertigo. What is vertigo? Believe it or not, I got vertigo myself a few months ago. Not fun. Woke up one morning with my balance off. I actually went to work. I knew that something was wrong with me. I knew I had vertigo right away. I was getting worried. I'm like, what the heck is this? I Googled it and found some exercises on the internet. So I started doing those exercises and it decreased the symptoms a little bit. But in the afternoon, I actually barfed my guts out. I got nauseous sitting in the office, and surprisingly, I was able to drive home. Once I got home, I immediately dry heaved. The world was just spinning, you know what I mean? My wife took me to the urgent care. They were closing, so they didn't provide me with any help. And I dry heaved again. I have to go to urgent care. So we went to CVS and I got some meclizine. The meclizine didn't help that much. I don't know why, but I don't think it was the solution for me. Anyway, I went home, slept, and then the next day saw the neurologist. She recommended vestibular PT and to get an MRI, and they put me through some goggle tests. You had to wear these goggles, and they verified that I had something called BPPV on both sides. I had it in the left and the right, which is a more complicated type of case. The good news is vertigo is curable in most cases. In my case, these crystals, or they call them otoliths, were in my ears, in my inner ear, were displaced. I just woke up and somehow they were all displaced on both sides. The vestibular PT would reset them. It usually takes about 2 to 10 weeks to cure this vertigo through the exercises. But after doing the exercises, they did help a lot. I was getting better every day with sleep, although stress and anxiety can put you in a relapse or increase it. So it was tough. It was tough having vertigo. Have you ever had vertigo, or you know anybody? It's terrible. I'd rather have pain than constant dizziness. The problem with my type of video is that vertigo can be recurrent. It could come back. The BPPV is a recurrent type of diagnosis. So what exactly is vertigo? Vertigo is the sensation of dizziness or a feeling that you or your surrounding areas are moving or spinning. It's often a sign of an underlying health issue rather than a condition itself. Vertigo is typically caused by a problem with the inner ear, or if it's a centralized problem, then you're talking about the brain. The sensation can be brief or last for a longer period, but may be associated with nausea, vomiting, or difficulty maintaining balance. So what are the causes of vertigo? So what I had was BPPV, which stands for benign paroxysmal positional vertigo. That is the most common type of vertigo, where tiny calcium crystals in your inner ear become dislodged, causing dizziness when you move your head. The other cause of vertigo is Meniere's disease. This is an inner ear disorder characterized by episodes of vertigo, hearing loss, tinnitus, ringing in the ear, and a feeling fullness in the ears. The big thing with that one, though, is you have like unilateral hearing loss. And there's also infections like vestibular neuritis or labyrinthitis. So infections or inflammation of the inner ear can affect the vestibular nerve, causing vertigo. A worse thing is when you get a head injury, a blow to the head can affect the inner ear, leading to vertigo. So that could dislodge the crystals, and then you have to reset them. Now, what are the treatments? The big one is the Epley maneuver. This is a series of head movements that help relocate displaced calcium crystals in BPPV, which can significantly relieve vertigo. There's also medications, right? So you could take meclizine, antivert, that type of thing. What the medications do is it hardens the fluids in your ear to stop all the crystals moving. But the problem with the medication is it's going to stop the effectiveness of the exercises. You're better off not going with medications if you know it's BPPV and just doing exercises. So the big thing is vestibular rehab therapy, right? This is a specialized form of physical therapy that aims to help the brain adapt to balance issues by practicing exercises that improve coordination and reduce dizziness. In rare cases, surgery might be required if the vertigo is caused by an abnormality in the inner ear or brain, such as a tumor or severe Meniere's disease. Lifestyle changes. Avoid triggers like sudden head movements in BPPV. You should also stay hydrated and avoid alcohol. You need to manage your stress, which may help to control the vertigo, especially if it's related to Meniere's disease or migraines. If you ever experience vertigo frequently or severely, you need to see a healthcare professional for proper diagnosis and treatment, like a neurologist. Now I am going to go over like a self-test and the Epley maneuver. If you ever get it or you know that somebody gets it, tell them to watch this video on the Epley maneuver. It should help them a lot. One of the first things you have to do is determine which side you have the vertigo on. Okay, so one simple exercise you can do to see which side is affected is actually marching in place for 10 steps with your eyes closed. So I'll do it now, right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If you notice that I kind of turned over to my right side, that would mean that my right ear is affected, right? So find yourself a little ottoman or a bed where you can lean your head off the side. So I'll go this way. I had it on the right side, so I'm going to start with my head turned to the right. I'll hang my head over the edge of the bed, and then I'll turn my head 45 degrees while my head is extended on this, because I'm starting with the right side, right? It's a right problem. I start with the right side, and I'll do this for a minute. This is the first Epley, right? So you do this for a minute. After a minute, what you're going to do is just turn your head the other way. Again, my neck is extended. I'm looking at a 45-degree angle. And then I'll do this for another minute. Then you're gonna turn onto your side and tuck your chin in and look at a 45-degree angle at the floor. This is the third Epley exercise. And you do this for a minute. That is basically the Epley maneuver. And what you can do to also test to see the effectiveness of the exercises, you may have to do it like 2 to 3 times in a day. But what you could also do to test how effective your exercises are is just to do like a straight line walk test, you know, like this. And then every day you test how well your balance is, like, you know, if you're falling off line a little bit more or less. So you can test how effective the treatment is. But these are very simple ways to treat vertigo. And that's all for today. Action, how's your night?